Respected chairperson, moderator, and my dear colleague, Assalamu alaikum and good afternoon. Welcome to my presentation. Here I am Dr. Md Badruddoza, completed my graduation from Dhaka Dental College Hospital and then completed my post-graduation on oral and maxillofacial surgery. I am working as an assistant professor, Department of Oral and Maxillofacial Surgery, Dhaka Dental College, Dhaka Community Medical College Dental Unit, and also working as a dental and maxillofacial consultant in Ibn Medical College Hospital, Kollanpur, Dhaka. Here I am going to share with my papers, and the topic is clinico-pathological variation of pediatric oral and maxillofacial malignancies and their treatment outcome in a tertiary level hospital of Bangladesh. Oral and maxillofacial malignancies represent a significant cause of morbidity and mortality among the pediatric group. Children aged between 5 and 14 years old die from cancer, is second only to death from accidental trauma. About 10% of all pediatric malignancies occur in head and neck regions as a primary site, and sarcomas about 14% of all pediatric head and neck tumors. The rationale of the study: the number of pediatric oral and maxillofacial malignancies are increasing day by day, with variable presentations and outcomes. In some cases, clinical outcome cannot be assessed and ensured due to lack of attention and information regarding management of such patients. This study on the above mentioned topic will help to better understanding of pattern of presentation, clinical evaluation, proper diagnosis and treatment with outcome of such disease through different treatment approaches. The general objective was to observe the clinico-pathological variation of pediatric oral and maxillofacial malignancies and their treatment outcome in a tertiary level hospital of Bangladesh. The specific objectives were to find out the clinical presentations, to know the histological pattern, to find out the recurrence and death rate, and to assess the outcome of the pediatric oral and maxillofacial malignancies following different treatment approaches. The material and methods. It was an observational study which was conducted in the Department of Oral and Maxillofacial Surgery, Dhaka Dental College Hospital from December 2019 to May 2022. The sample size was 20 and conventional sampling method was selected. All pediatric patients of indoor and outdoor department with histologically proven oral and maxillofacial malignant neoplasms from the selected department were included in the study. The exclusion criteria were the malignancies of eye, intracranial region, thyroid and parathyroid gland, trachea and esophagus. Now come to the result. In my study, I found that majority of the patients were in group 0 to 5 years and 11 to 18 years of age, and it is about 40% of the patient. The mean age was 8.85 and the age range from 1 year to 16 years. In bar diagram, we can say I found that in 0 to 5 year age group, 3 rhabdomyosarcoma, 2 non-Hodgkin lymphoma, 1 primitive neuroectodermal tumor, and 1 ganglioneuroblastoma. And in 6 to 10 year age group, I found 3 rhabdomyosarcoma and 1 Langerhans histiocytosis. In 11 to 18 year age group, I found 1 rhabdomyosarcoma, 1 non-Hodgkin lymphoma, 1 osteosarcoma, 1 Ewing sarcoma, 1 chondrosarcoma, 1 myxofibrosarcoma, 1 Langerhans histiocytosis, and 1 mucoepidermal carcinoma. In my study, I found that male and female children were equally involved. That is, ratio is 1:1. The distribution of the patient according to site of the lesion. Regarding the site, maxilla was the most common site and it was about 40%, followed by mandible, tongue and buccal mucosa. Distribution of the patient according to clinical presentations. All patients came to us with swelling and 90% had pain, 45% had tooth mobility and ulceration, 40% had malocclusion, and 35% had lymphadenopathy. The distribution according to treatment modalities. Here we found that 40% of the patient received neoadjuvant chemotherapy and surgery. 25% received only chemotherapy. 2 patients refused our treatment plan, and 1 patient died before starting his or her treatment procedure. Now, initial outcome and treatment modalities. In my study, I have found that about 50% of the patient had no evidence of disease, 45% died, and 5% relapsed during my study period. Limitation of my study. The sample size was small. Sampling technique was not randomized. This study was not blind. It was conducted in a single tertiary level hospital, which may limit the diversity of the patient population. And the recommendations are: the more studies are needed to analyze. The practitioner and health workers who work in the rural area of Bangladesh should improve their knowledge and diagnostic skill regarding pediatric oral and maxillofacial malignancies. The government and non-government organizations, that is NGO, should take necessary steps to increase the awareness among the people of Bangladesh by arranging various programs. And I am very much thankful to my mentor, Dr. Assistant Professor Dr. S.M. Anwar Sadat sir, and Assistant Professor Dr. Naushat Kaisar Patan. And I also very much thankful to my wife, Dr. Israt Jan Firdaus. In conclusion, I want to say the pediatric oral and maxillofacial malignancies are aggressive in nature and rapidly progressive. Control of disease is very difficult. Multimodal therapy can give better outcome. Debulking surgery does not offer any advance in terms of curative results, which can be considered for palliative purpose. Early presentation, rapid evaluation, and immediate treatment approach can increase survival rate. And the references. And smile, it raises your face value, and thank you.